Hi, everybody. So excited to be here. Lauren and I have been talking about this, working on it for a long time, Lauren. I want to tell everybody that functional medicine and Lauren have been a part of RPhAlly basically when RPhAlly was reinvented back in October of this year. So 6 months she's been in the grind, coming to the meetings, just a lot of other things going on, but we finally get to launch, Lauren. So why I want you guys to tune in after I hit this reel is this. Lauren and I are going to cover why does functional medicine matter? Why does it matter in modern healthcare? Why are so many people talking about it? And we'll jump into that right now. You don't need an introduction, Lauren. Like everybody, I feel like everybody knows you. Like it's the Dr. Lauren Castle, but it's so nice to finally have you as part of the team and get things rolling. Lauren, how are you?
I am doing amazing, and I am so excited for this launch. I know it has been a long time coming, but good things come to those who wait, right?
Amen. So true. And it's funny you say that to kind of lead into the conversation of good things come to those who wait, because oftentimes we want instant gratification in medicine, right? We think the allopathic pathway is I've got a problem, I'm going to solve it by giving you this or doing this immediately, and now it's fixed. And you and I both know that that's not the case. And oftentimes it leads to more and more problems that get compounded over time. So can you, I know that you could probably write a dissertation, do a couple books on this, Lauren, but just to break it down for the healthcare providers that are watching or tuning in on different spaces, why does functional medicine matter to their practice? And why does it matter that they become more familiar with it?
Absolutely. So, for those of you who aren't familiar with functional medicine or who I am, I know, Kevin said I don't need an introduction, but my whole goal of being part of RPhAlly is to meet new pharmacists that I haven't reached before, that I haven't met, that I haven't had the opportunity to talk your ear off about functional medicine and why it's important. So, for those of you who haven't seen me around online, my name is Lauren Castle. I've been in the functional medicine space since 2015, whenever my husband was having his very own health issues. And, like we said, we were really looking for like quick, easy answers as to why he wasn't feeling good. And it seemed like no matter what I would try, nothing really would help, right? Like just random symptoms. And eventually we got to the point that, like, something's got to give here. Like, we can't just go on living like this. Like, we should be pretty young and healthy for our age. And yet, like, we can't figure out what's going on. And so, instead of continuing to just settle for covering up symptoms with, as we say, a pill for every ill, we got into this functional medicine approach. And it was really just through like a flyer on our doorstep, right? Like, of all things.
Wow.
And went in for this seminar, kind of learned about this new approach. And at the time, Cleveland Clinic was just getting started with their Center for Functional Medicine. So I'm from Ohio, well, originally from Michigan, but I live in Ohio now. So we were kind of like, all right, well, maybe there's something to this. And sure enough, as we went through this process, all of the symptoms really started to disappear. And so for me, that really became this like aha moment of why don't we learn about things like nutrient deficiencies and like all these different gut overgrowths and candida and like hormone levels and things that can affect our everyday health even when we're younger, right? And so it was fascinating to me that as we started to change our diet and work with some supplements and do these extended lab tests that we didn't cover in pharmacy school, I actually also started feeling better. I was just being the supportive wife, right? And I started to feel amazing, right? And I didn't even think I had any
Wow.
health issues or symptoms.
Yeah.
But that's really what sets functional medicine apart, is that you can go from just getting by, feeling fine or okay, to
Yep.
actually feeling amazing. And, for me, it just became this passion of like, every patient deserves to have a pharmacist that can learn this approach and can feel this vibrant and healthy. And I think a lot of us in pharmacy, I've been with the same retail company for 12 years now, and just really saw this as like the missing link of, I see my patients come to the pharmacy with their grocery cart full of, not the healthiest foods, and food really is medicine. It's very powerful. And so we need to be better equipped in order to help make those recommendations and be able to do it in a way that is really accessible for patients, right? That it doesn't become overwhelming for them. I think that's why pharmacists are so uniquely positioned, as we all love to say, but really and truly we are.
Mhm.
So it's just been a passion for so long. And now I feel like it's really starting to become more mainstream. So perfect timing for this channel to become part of RPhAlly.
Quite the genesis story that you go from an individual with a flyer on their doorstep to someone that is opening up an alliance of pharmacists focusing on functional medicine for you, Lauren, with that kind of genesis story as you're kind of progressing along the way, learning more about functional medicine, probably learning more about integrative medicine and how those things all kind of blend together. That the fun thing that you and I've talked about before that Laura and I are going to start doing kind of a weekly get together so you guys can get tapped into it a little bit further is when you start looking at our different modalities and specialties, one really fascinating thing is the interweaving that you start to appreciate. And even when Lauren was giving her intro there, I'm thinking that fits in so well with patient advocacy. That fits in so well with deprescribing. That fits in so well with herbalism. I mean, there's so many elements of lifestyle medicine and modifications to therapy that change. But for me, Lauren, being a hospital pharmacy director, what grabbed me was you saying extensive labs immediately,
Mhm.
because that is one of the difficulties of seeing a patient for the first time and they've had zero labs in their entire life. Like they've never evaluated baseline, for themselves, and seeing
Yeah.
what happens in functional medicine to really tap us into, why do those things actually matter? Why should we care about those things is really exciting. So caring about those things and being exciting, I think that's why I'm excited to hear this, Lauren. What's the reason you felt like this is the right time to be able to join an organization like our PHAlly and bring the functional medicine into the woven puzzle?
Yeah, I think for me, it's really been, like we said, a long time coming. The work with FMPhA and the Functional Medicine Pharmacists Alliance really just started out as a Facebook group back in 2017, whenever I was just in the beginning stages of my own functional medicine journey and trying to figure all of this out. For me personally, I ended up doing a master's degree in nutrition and functional medicine. And I will be the first to tell people that you do not need to do a master's degree in order to practice functional medicine. And so, as this becomes so much more intriguing for pharmacists who are starting to have their own health experiences or have patients starting to ask about it, because, like we said, it seems like every day there's a new book coming out or a new article coming out, right, about nutrition and lifestyle. And so it really just made sense that we could work together and share this knowledge between all of these different pharmacists. And so that was kind of the origins of FMPHA, was really just through Facebook and very organically making connections. I never set out to actually start an organization at all. That was like not in my game plan. It was just truly grassroots effort to start meeting other pharmacists in this arena, and then very quickly realized the need for it because there just weren't any resources that were really geared towards pharmacists. So there's plenty of training programs out there in functional medicine. But as I started to explore all the different options, they didn't even know what the role of a pharmacist was. So I would go to a conference and they'd talk about multidisciplinary teams, and there would be no pharmacist even listed. And so
Wow.
kind of had to start getting up there and just raising our hand and saying, hey, pharmacists are a crucial part of a functional medicine team because so many of these patients are stuck in the conventional realm with all of these prescriptions that they're managing, and they're seeking outside providers because they're just tired of getting the same old runaround in their primary care offices. And so if they don't have a functional medicine doctor that's their primary physician, they're looking at working with chiropractors or acupuncturists or, different modalities, which is great. And we love to see that. But someone's got to be that bridge to help with managing the medications as well,
Right.
especially when you start throwing in lots of supplements and all of these other things, right? It's like a perfect fit for pharmacists to really be involved. And
Definitely.
so that was really what prompted the change of like, okay, we need to actually come together and start organizing as a group. And so I think it's, again, really perfect timing because we're kind of at this next evolution of the work with FMPhA. And part of that has been working to expand the circle, right? Instead of it just being a Facebook group or just a membership, now we have an online course that we're really excited that we finally launched that sort of teaches pharmacists everything that they need to know. And that's going to be part of what is in the functional medicine channel on RPhAlly. So that way you don't have to go searching all over the internet and, spending hours upon hours trying to understand how do I get started in functional medicine. If you're here, if you're at RPhAlly, we are here to support you. And I can't be more excited about that.
Oh, that's amazing. And I think, Lauren, you and I have talked about this offline so many times that the education is part of it. Like Lauren and I want a centralized location that if you have if you are a specialist and you're doing something that's different than what Lauren and I are kind of putting together with our team at RPhAlly, let us know. We'd love to have you and be able to do something more there. I think the other pieces that we're really adding together is beyond the teaching. Like, how do we create opportunities? How do we make real change? How do we start organizing people together? And I know Lauren has lots of thoughts on that she's been working on. Other thought leaders have thoughts on the things that they'd like to do. And I think having the participation, Lauren, of our collective like brains inside of these channels and working with people like you is probably the most exciting thing for me within RPhAlly. Is it doesn't have to be just here's more training for you to get, even though I do think the training is essential for you to take the next steps. But it's how can we advocate together for utilizing our specialized knowledge to help and benefit patients overall. So any other thoughts there, Lauren, on taking it even further to create that community that can really make a difference?
Absolutely. And again, I think you kind of said this at the very beginning, is that it really takes making functional medicine not mainstream, like that it's not even just like a buzzword or anything like that, that it's fully integrated in with, like, when someone says, oh, like I do pharmacy, like functional medicine and pharmacy are just one and the same thing with medicine, right? That like this just becomes the normal way we do healthcare. And part of that comes from really integrating it in, like you said, with all the different modalities that are out there. And that's one thing I love to kind of say to put things in perspective for people, is that all functional medicine is integrative. Not all integrative medicine is necessarily functional. So it's possible to, send someone out for acupuncture or massage therapy and put them on some turmeric for their pain, but never get to the root cause and still continue to cover up the symptom. So that's really the difference. And so, again, it's taking all the different modalities, putting them together and layering in this functional medicine approach that's going to help for our practitioners to be able to actually treat that root cause and start to see the changes that we really want to see for our patients.
Oh, I love it. I want to thank Dennis for his comment there. And I think it really is a testament to what Lauren is trying to pull together with the complexities biologically that functional medicine is trying to answer, that it's just not, I'm experiencing these symptoms, here's the pill for the ill, but truly getting down to what is going to help that individual long term. And then we also have Dr. Christina Fontana on here, which that I know both Lauren and I love. And Lauren and I are going to a really exciting conference, the Healers in Healthcare. Lauren interviewed, I think, Christina just the other day or coming up really soon. And then I'm interviewing Christina here next. Oh, yeah.
Yeah.
And then Thursday, So with that being the case, we're kind of seeing a movement, I think, overall, Lauren, of us just getting together more often, if that is networking through RPhAlly, if that's going to conferences and doing things together for Healers in Healthcare coming up here May 5th through 7th in Cincinnati. But why do you think that is, Lauren? And how do we actually bridge that gap between good ideas, good connections, good practices to it actually happening? Because you mentioned you've been with a retailer for 12 plus years. But you and I have also talked about sometimes the barriers to being able to practice inside of those retail settings. Where do you see those next steps going with us being able to evolve as a profession?
I love this question. And at the risk of sounding maybe a little woo-woo, as some people would like to say,
Yeah.
There really is a massive shift occurring, not just in healthcare, but in our world right now. And I think a lot of people are starting to, whether you think about it like is just an analogy, but sort of waking up to understanding the choice that we all have in how we live our lives and the choices that we all have in terms of our healthcare decisions, in terms of our livelihoods, and what we do for our jobs and our work, right? Like COVID, of course, really accelerated all of that. And I think pharmacy was hit especially hard. Healthcare as a whole was hit especially hard, but it was global, right? Everyone started to realize like we only have one life, we only have one planet, and the most important thing truly is our relationships, the people, the experiences. And so it all fits in together, right? And at the end of the day, like we're all working towards the same goals. We're all working to have a better healthcare system, right? To be able to live a long, healthy life, to be able to have our families be healthy, right? So it all comes together. And I think now people are just starting to realize more than ever they have choices, they have decisions that they can make in order to actually move towards those goals. And we don't have to stay stuck in the way that things used to be.
I,
So I
I
think
love the
all, yeah, coming together is how we're going to make that actually happen.
stuck is a perfect word, Lauren. The reason I just did a lecture the other day at Washington State University and some of the students and talked about, we've been following the evidence for a while and failing our patients over and over and over, and now failing our healthcare practitioners, our colleagues in a burned out kind of situation. So being able to find a new way to approach healthcare, to do it in a way that can truly care for those patients. I mean, dispensing health like that, I have no trademark. You guys can steal that, go for it. But I do think dispensing health is the next evolution for us, Lauren. And our patients are wanting that. Our systems are wanting that because they're seeing that, what's happening in the fee for service world is just not working for actually moving the needle for patients in general. And so we're seeing those things happen. Next steps for us is what we're doing right now. Having those conversations, making folks aware, and seeing the opportunities that are out there and taking advantage of them. And in lieu of time, and I know Lauren is a very busy woman, but thank you guys so much for tuning in. The Functional Medicine channel will be launching here really soon. We'll be doing a write-up on Lauren, and we'll be blasting out to all of our members on RPhAlly to learn more about her. And we'll be launching on Thursday this week. That'll be live and running, so you guys can jump in there and learn more from Lauren. And then please join Lauren there and myself to be able to talk about functional medicine, how it can impact you, and then learn more about her course. She's already done a cohort to be able to run everything through, had wonderful feedback from all the folks with individual testimonials. And I'm really excited, Lauren, for that to get out there because more pharmacists need to be able to recognize how they can leverage that in these concierge practices and private practices and all these other spaces that are starting to open up for us in terms of opportunities to change our vocation. Lauren, I'll let you kick us off though, or finish us off here. Any parting words for everybody?
Yeah, like I said, I'm so excited for this channel to finally be open. Please join and ask any questions that you have. I am an open book when it comes to providing guidance. Yes, the course is there and it's a resource that will give you the structure you need to actually go from, okay, what is functional medicine, to at the end of 6 weeks saying, okay, I have a business plan to understand how I want to use it, what training I do or don't need, and really understanding how to set up a practice for yourself in whatever way you want, right? Whether that's entrepreneurship, which is, obviously hugely popular right now,
Yep.
or if it's more of entrepreneurship, right? Because again, I still work retail and I'm using my functional medicine knowledge every single day. And now actually seeing big companies looking for this approach on larger scales. So there's no better time to get involved and even just start dipping your toes in the water again. Like you can take as much or as little of this as you want, but if you have a desire to truly help your patients heal or help yourself heal, like if you have been dealing with any type of health issues or have family members dealing with health issues, I can't recommend just looking into this approach and seeing what it has to offer for you.
Amazing. Lauren, thank you so much. Always a pleasure. And we'll see you guys over at the Functional Medicine channel here very soon with Lauren on rphally.com. Have a great night, everybody.